What's up, everybody? My name is Eric. Welcome to my channel, Eric the Tutor. What's up, everybody? My name is Eric. Welcome to my channel, Eric the Tutor. Today, we're going to be talking about orienting a couple bones of the upper limb. So we're going to talk about the clavicle and the scapula and the humerus. All right, and in the next videos, I'm going to make a series of videos on the bones of the upper limb and then the muscles that attach to those bones, as well as their innervation and their muscle attachments, their actions, and a couple clinical correlates, as well as some muscle testing. So it's going to be quite extensive amount of information, and I'm going to break them down into smaller videos. All right, let's go ahead and jump into it. So when we're orienting our clavicle, so here is my clavicle, I need to determine in the lab whether it's going to be a right or a left clavicle, right? And this is going to be the case for any bones we get in lab. We have to identify what bone is it, and is it going to be a left or a right? So one way I like to start off the bat immediately, I would like to find my superior and my inferior, all right? So when I'm in the lab, I look for my superior view. My superior view is going to be the most smooth surface. So you're going to pick it up in lab and you're going to see, okay, this is very smooth on top. And on the bottom, my inferior side is going to be more rough. It's more rough because I have a lot more things attaching down there than on the top, okay? So that's a shoe-in, all right? The superior side is smooth, inferior side is rough. That's a good start. Now we kind of need to determine posterior and anterior, medial and lateral. So I suggest finding your conoid tubercle. So your conoid tubercle is going to be posterior, okay? So that's huge, right? So we want to be able to find that the conoid tubercle, it's this pretty large pronouncement in the bone. It's posterior. It's also in the lateral 1/3 of the clavicle. So right here I have about, the medial 2/3, and then I reach right about here, and now I'm in my lateral 1/3, okay? So not only does the conoid tubercle tell you that this is facing posterior right now, I also tell you that this side is lateral. So now I have that this is inferior, because it's rough. I have my posterior side here, and I have that this is lateral, right? This is lateral, okay. So let's jump over to this left side. So another way to tell if something is medial, my medial sternal end is going to be more round, and my lateral acromial end is going to be a little bit more flat, okay? So now I have medial, superior, and I know back here, can't see it because, it's a little bit posterior and a little bit inferior, is going to be my conoid tubercle. So this has to be the left clavicle because this is the superior view. This has to be medial because my conoid tubercle is lateral, and then this is posterior. So anatomically, this is sitting as the left clavicle, right? So if the sternum was over here and the acromion was over here, then this is exactly how it would look anatomically if we were looking at a skeleton, right? Posterior back here. So back here would be posterior. Up here would be anterior. And then we said this was medial, and over here was lateral. And we're looking at the superior view. Okay? So let's go ahead and jump to the scapula. All right, so now we're looking at the scapula. So for me, I love to find my spine of the scapula is going to be posterior, okay? So this is my scapular spine. My scapular spine is posterior, and it's going to run, and it's going to long, and it's going to hit my acromion process, okay? So why I like to do this is because this is telling me, one, I'm posterior, but once I hit my acromion, I know my acromion is very, very lateral. So if this is lateral, and it's also superior, I already have this thing oriented. I know this has to be my left scapula. This is left scapula because if the acromion is really lateral, it kind of makes sense because, the glenoid fossa is over here, and that's also facing lateral because the humerus would be sitting like right about here, okay? So this is posterior because of the scapular spine. The acromion is superior, and it's also lateral. So now I have this thing oriented the way it should be. right? This is the left scapula. Let's go through some of the major points here. So now that we have that this is lateral because the acromion, then I can find my lateral border of the scapula. Okay, this is the lateral border. If there's a lateral border, that means there must be a medial border. Notice how much longer this one is and how upright it is. This is the medial border. Down here I have the inferior angle. This is my inferior angle. If there's an inferior angle, there should be a superior angle. Here's my superior angle. All right, so up here is superior. And then right here, I have my scapular notch. Now, it could be a scapular foramen, but we see over here on the left as well that this is not fully closed. If it was fully closed, it would be a foramen, but we call this a notch. This is our scapular notch. All right, so that's our scapular notch. So all of this is our infraspinous fossa. We call it infraspinous fossa because it's going to be housing my infraspinatus muscle. So here's my infraspinatus muscle all along my infraspinous fossa. It's my infraspinatus muscle. Up here more superior, I have my supraspinous fossa, which is housing my supraspinatus muscle. Here's my supraspinatus muscle on my supraspinous fossa. Great. Now, coming off of the inferior angle of my scapula, I'd expect to see a muscle originating off of there. That's going to be my teres major. So my teres major originates off of my inferior angle of my scapula. Now, superior to my teres major, I have my teres minor muscle. My teres minor muscle runs along the lateral border of the scapula. All right, so minor over major. Let's go ahead and move on to the anterior view. So over here I have some more fossa. This is my subscapular fossa. Which muscle do you think originates off of my subscapular fossa? It's going to be my subscapularis muscle. This is my subscapularis muscle right in here. Moving on to my glenoid fossa. This is my glenoid fossa. I have the head of the humerus that articulates with my glenoid fossa, forming a glenohumeral joint. That's the shoulder joint. The last thing I want to talk about for the scapula is the coracoid process. So here is the coracoid process. The coracoid process is very anterior and has muscles attaching to the coracoid process. So it has the pectoralis minor and the coracobrachialis, for example. These muscles are on the anterior side of the body, which makes sense because this is facing very anterior. And it's a little bit medial to the acromion, but more importantly, it is very anterior, okay? So that's the coracoid process. Let's go ahead and move on to the humerus. So for my humerus, let's go ahead and zoom in on my humerus. So I need to determine if my humerus is superior or if it is inferior. Okay, so in order to determine if something is superior and inferior, I look for my head of my humerus. My head of my humerus is superior. It also faces medially, so I'm going to write this is medial. This is perhaps medial. In order to confirm that it is medial, I'm going to look and see what is on the anterior side of my humerus. So on the anterior side of my humerus, I expect to see my intertubercular groove. So this is my intertubercular groove. I know this is on the anterior side. I also expect to see my condyles very visibly on the anterior side. So I can see my trochlea. This is a medial epicondyle. And my capitulum is on the lateral side. So this is a lateral condyle. Okay, so these are condyles. Trochlea is also a medial condyle. Above them are the epicondyles, okay? So above the condyles are the epicondyles. So this right here would be my medial epicondyle. And then over here, this is my lateral epicondyle, okay? Trochlea, medial condyle, capitulum, lateral condyle. All right, so this determined that this in fact was the anterior side of my humerus. This is medial because the head of my humerus faces medial, and my trochlea should be medial as well. And on the lateral side, I'd expect to see my deltoid tuberosity. This is where the deltoid muscle is going to be inserting, right here on my deltoid tuberosity. So this deltoid tuberosity is also lateral, another good landmark. All right, let's talk about the surgical neck. Surgical neck is an area that's sensitive to break, as well as my anatomical neck. So this is my anatomical neck, okay? Now, both of these areas are sensitive for fractures. If I damage my surgical neck, it's possible that I'm going to damage my axillary nerve. Axillary nerve damage, okay? So if I damage my surgical neck, I'm worried that I might have an axillary nerve problem, okay? Other piece of information, so right here, I'll do it in yellow. This is my lesser tubercle. This is my lesser tubercle. It's very anterior and it's more medial relative to my greater tubercle. Is a little bit more lateral. It's a little bit more lateral relative to my lesser tubercle, okay? These are important because certain muscles are going to be attaching there. So my lesser tubercle is going to have the subscapularis muscle. So the subscapularis muscle is going to insert onto the lesser tubercle. That's the subscapularis muscle. And then the greater tubercle is going to have other rotator cuff muscles such as the supraspinatus muscle, the infraspinatus muscle, and teres minor. All of those are going to be attached to the greater tubercle. Okay? So see any other landmarks we want to talk about. That intertubercular groove is important because that's where the latissimus dorsi is going to insert, and just lateral to that, the pectoralis major is going to insert just lateral to that intertubercular groove, and just medial to that intertubercular groove, I'm going to have my teres major. So those muscles are on the anterior surface of my humerus. All right. Let's go ahead and move on to the posterior surface of my humerus. On the posterior side, I have a radial groove. So right in here is a radial groove. My radial groove is important because that's where my radial nerve is going to be running. My radial nerve runs along my radial groove, okay? And another piece of important information is the olecranon fossa. So the olecranon fossa is where the olecranon process of my ulna is going to insert. So that's where the olecranon process of the ulna is going to insert into the olecranon fossa of the humerus, okay? And then this is my trochlear notch. This is part of my ulna. So my ulna, the trochlear notch is going to be inserting here into the trochlea, all right? And that is about everything for the humerus. Here's the coronoid fossa. So the coronoid fossa is superior to my trochlea. Just want to make sure we covered that. But that should be everything, guys. All right. So that was bony anatomy. Stay tuned for, we're going to talk more about muscles. Well, actually, I want to talk about one more thing here. So since we were talking about the scapula and we were talking about the humerus, let's talk about some of the joints that we'd expect to see in the lab. So if I have a acromioclavicular joint, and I'm trying to find that. Well, my acromion process is here, and here is my clavicle. So this would be my acromioclavicular joint. We talked earlier about a glenohumeral joint, so here's the head of the humerus inserting into the glenoid fossa of the scapula. So this is my glenohumeral joint. All right. Can't be appreciated in this view, but this is my sternoclavicular joint. My sternoclavicular joint, if I find the sternal end of my clavicle, my sternum would be somewhere over here. So right about here would be my sternoclavicular joint, right? An articulation between the clavicle and the sternum, okay? That's everything, guys. So thanks for tuning in. We'll go ahead and see you guys next time when we talk more about muscles and some clinical correlates as well. All right, thanks for tuning in. We'll see you next time.